The question of should I enroll into Medicare is probably one of the most confusing aspects to Medicare itself. There are sometimes no hard and fast rules, so therefore Medicare really is not black and white. So we spend a lot of our time with every single person that we consult with talking about their options. Are you eligible for retiree coverage? If you are, what does that coverage look like? Does it make sense to enroll in that coverage? Just because you have retiree coverage available to you, unfortunately, does not mean that it's better than traditional Medicare or some Medicare options. Sometimes it is, sometimes it isn't. Are you actively employed? So if you are still working, do you need Medicare? Chances are no, but we don't know that for sure. You could be in a small employer situation where under 20 employees does require you to go get Medicare Part A and Part B. So you can see there's not a hard and fast rule even with working. If you're working and your health is not the most optimal of health, then maybe you're using your coverage a lot and maybe you're paying a lot of premium for it. Or you're extremely healthy and your employer might be subsidizing 90% of the premium. So if you're paying for premium at work and it's a fair amount and maybe you're using coverage a lot, you definitely always want to compare that to Medicare. But if you're paying $50 a month and your health is pretty good and your coverage is excellent, then we would suggest don't get Medicare until you need it. Other situations are such as a marketplace. Are you on ACA coverage? If you're receiving a subsidy with the ACA, you need to get off of that subsidized coverage and you do have to go to Medicare. Your subsidy will stop. So that's a totally different situation. COBRA insurance. When you are leaving an employer or have left an employer and you're turning 65 and you are on COBRA, you have to understand that COBRA is now secondary to Medicare. So you do need to go get Part A and Part B of Medicare. And if you don't have that in place, you could have some glitches with COBRA carriers, possibly denying claims as they are in a secondary role to Medicare. So the question of can I or should I sign up for Medicare, you can see is extremely individualized. Please do not rely on neighbors and friends and family that tell you that you have to do one thing or the other because everything is very unique to you. If they have employer coverage that is highly subsidized and you do not, then their advice is not going to hold true for you. If you call one of our advisors, we will go through the entire comparison for you. You have to look at cost and coverage. People do not understand what Medicare coverage looks like, and they do not understand the cost. Always compare that. Then you can arrive at your answer of, should I enroll into Medicare?